I would like to talk to you about rheumatoid arthritis. This is one I have symptoms of personally. 1 in 12 women and 1 in 20 men have this autoimmune disease, which takes a while to diagnose. This condition causes excruciating pain that stops one from doing simple tasks like eating and getting out of bed. The attack in rheumatoid arthritis is on the joint and the gut. A low-carb diet and nutrient density reduces inflammation and deals with the root cause and improves the quality of life of most autoimmune disease sufferers. Bone health is linked with immune regulation. The experience of trauma, like an accident, can trigger rheumatoid arthritis. The spleen has a part to play in the development of rheumatoid arthritis. It has a spectrum of severity. At the mildest, you would have rheumatoid factor, a positive rheumatoid factor, and some joint pain, but you will not have fluid pockets or signs of inflammatory arthritis. You may be told that you have a false positive for the rheumatoid factor, which is seen in early detection, showing you are at risk of manifesting rheumatoid arthritis. And it's a good place to start working on preventing the disease from progressing. The extreme case of rheumatoid diagnosis will be having arthritis in multiple joints with fluid pockets, and it would normally affect the hand, the wrist, and feet. Other joints may be included or involved. It would affect both sides of the body. It will be present for more than 6 months, usually accompanied by a positive rheumatoid factor. Sometimes, maybe not. RA causes an inflammatory cascade within the body, and the body that focuses especially on the joint, leading to a high level of pain. And if unchecked, it could lead to a disability. The inflammation also affects the rest of the body, and systematic inflammation increases the risk of heart disease and cancer. For an RA diagnosis, most rheumatologists would test for a positive rheumatoid factor and anti-CCP antibodies. It is best to test for individual rheumatoid factors in addition to a combined rheumatoid factor that is more typically ordered. So normally they would request for a combined rheumatoid factor, and this does not give a full picture. An individual rheumatoid marker can be elevated. IgG, IgA, and IgM. When the combined rheumatoid factor CCP, a combination of all three, could be negative. So it's best to get all of these markers checked. The most relevant factor is the IgM. Most rheumatologists track CRP, which gives an idea of how much inflammation or stress the body is going through. And ESR, C-reactive protein, also gives an idea of this. So the CRP means C-reactive protein, and the ECR means erythrocyte sedimentation rate. All of this would help the rheumatologist to make a better diagnosis. You want to insist every rheumatoid factor is checked, especially if you have the symptoms mentioned. Most rheumatologists use an X-ray to track joint damage. It is really, really important to use a muscular ultrasound and Doppler ultrasound because it will give a clearer picture. X-rays offer just a few views of a joint, whereas an ultrasound can give up to a 180-degree view. The ultrasound can catch bone erosion sooner. It also measures fluid pockets, an active sign of inflammation, and has no radiation exposure, whereas X-rays do. Basically, X-ray is a myopic view. If you're moving to recovery, there should be improvement when you do subsequent X-ray. To measure body-wide inflammation, but this can be normal even when inflammation is present. There are up to 12 additional inflammation markers that you get through a vectoral DA blood test. These 12 inflammatory markers include things like LOL2, LOL6, LOL8, and LOL10, TGF, IO2 receptor, vascular endothelial growth factor, immune complexes, C1q, Regicell SA, TGL. All of these things need to be checked, and your rheumatologist would have all of these checked just to make sure they have a clear view of what is going on and how much damage has been done. People with rheumatoid arthritis have a high level of osteopathy. Small intestinal overgrowth is common with people with RA. You may develop multiple sclerosis, diabetes, Hashimoto's, depending on your genes. If you do not deal with RA, it will destroy your joints. It is the disability people get after affected by, and the inflammatory effect is a systematic one. Osteoarthritis is not the same as rheumatoid arthritis. You might not look sick on the outside, but sick on the inside with slow loss of function. It will change every aspect of your life simultaneously. Constantly secreting cortisol, which is the stress hormone, decreases the uptake of calcium from the bone, causing loss of bone density, weight gain, mood swings. Smaller erosion reverse and the bone rebuilds as you start to change and improve your lifestyle. Erosion can heal, but if it is less than 2 meters, this means that if it is over 2 milliliter, then it is there to stay. Anything less than that amount can gradually heal. It is advisable to go on a gluten-free diet for at least 3 months. And it's also advisable to have these two ultrasounds, the musculoskeletal ultrasound and a Doppler ultrasound to the affected joint. And from that 3 months of going on a gluten-free diet, you want to monitor yourself and see if you notice improvement. Some people may need to go on a prescription medication, and some people don't, depending on how much damage is done. Some people who go on a gluten-free diet see up to 50% improvement. Some other people may need to go on a gluten-free diet, including being on a medication. It really just depends on how much damage that needs to be repaired. The reason a gluten-free diet is advisable is because with all human beings, after being exposed to gluten, after 30 minutes, we have intestinal permeability, which is known as leaky gut, the main enemy to autoimmune diseases. the event that happens with autoimmune disease is a leaky gut. So you need to consume something that would not lead to a leaky gut. And this includes all the nutritional suggestions I will be making on the nutritional audio to help heal your gut and resolve and improve or reduce some of your symptoms. Rice is higher than Coca-Cola in terms of level of sugar and has a detectable level of arsenic because of heavy metal toxicity. Decreased sugar or a low sugar diet, an increased sugar or higher glycemic food and dairy does not go well with people with RA. You may want to also consider removing nightshades. These include foods that are shaped and look like tomatoes. Protein in your blood and you're making antibodies. These are all signs that you may have arthritis. You need to do an elimination diet with them and reintroduce them to see how you feel. So you want to remove things like nightshade. Nightshades, like I was mentioning, are things like tomatoes, sweet peppers, the big ones, things like white potato and aubergine. So anything that looks like tomato with seeds inside of it. If you look up nightshades, you will get an idea of what I'm talking about. It's always best to take these things out after a couple of weeks and just see how you feel. If it doesn't make a difference, then maybe it's not having an impact, but definitely dairy, gluten, you want to take out first and see how you do before you go on to eliminate other things. And an improved diet is really recommended for RA intervention plan. So food elimination will be the first thing, and those things I've mentioned, those food I've mentioned is one. Science has shown that gluten causes leaky gut, and leaky gut needs to be present for autoimmune disease to develop. Go rice free. Like I mentioned earlier, it contains arsenic, a heavy metal toxicity, and it can interfere with autoimmune healing. You may want to remove rice altogether from your diet. Limit your intake of all forms of sugar and high glycemic food. Go dairy free, go grain free. That means beans, legumes. These things contain something called lectins. You want to go off them and see how you do. Probiotics and prebiotics are things that you want to introduce into your diet. I always recommend sauerkraut for probiotic. It would help repopulate your gut microbiome with the good bacteria. Now, when you put in this, repopulate this bacteria, you want to feed them. And these are prebiotics. They come from onion, leeks, what's the other one? Onion, leek, garlic would help feed these good bacteria to help you improve and boost your immunity. Some people may need to go on a medication to relieve their pain. Some people go on low dose of antibiotics, and bear in mind, if you're on antibiotics, you want to also use probiotics to help replace these the bacteria that is going to be wiped out by these antibiotics. Some people use a low dose of naltrexone prescribed by their doctor. It's naltrexone, and also some people use medical marijuana. a topical or edible one is more advisable. Research shows that it's best instead of smoking or vaping it. Things that can affect autoimmune expression can take time to address the symptoms. This is why it needs to be caught on time for diet and lifestyle change to work. The more damage is done, food or medication alone might not work. It may be best to use both. And sometimes if you have time and you're not in so much pain, lifestyle change, a diet and lifestyle change will help. You want to improve your sleep hygiene as well. With any autoimmune disease, a good sleep hygiene helps to repair your body and helps your body get rid of toxins too. Some people with RA go into remission, but again, it depends on how long and how much damage has been done. A sign of improvement include having reduced to no swollen joints at all. Some people achieve this with or without taking medication. Intentionally pursuing the healing of the root cause of this disease will have a massive impact on symptoms and control disease progression. I really wish you well on your healing journey.